Now, for some of you guys that don't know, I've been living with an eye condition called glaucoma for almost 15 years. Now, unfortunately, there is no cure for this condition. But in today's video, I want to talk to you about what I've been doing to manage this condition. My name is Dr. Adesola Fade. I'm a sports vision optometrist and a glaucoma specialist. And welcome to the channel. Hey guys, welcome back to the channel, and we are back with another episode. If this is your first time with us, thank you so much for pulling up. But do us a favor, give us a like, subscribe, hit that bell for notifications so you're always made known every time we drop content. Now watch this. What are we talking about today? We're talking about what I do to manage this condition called glaucoma. Now, in order to even tell you what I do, you got to know what glaucoma is, okay? Now, if you watch one of my other videos, I kind of describe glaucoma in detail. Now, for some of you guys that watched my earlier videos, you'll know that I was diagnosed with this condition when I was 21 years old. So for me, I've been on what we call topical therapy this entire time. Topical therapy means that I'm getting prescribed eye drops that I'm either taking twice a day or just once a day, usually in the morning and night or just at night. Now, the first drop that I use is called Xalatan. Now, Xalatan, also known as Latanoprost, is what we call a prostaglandin, okay? Now, this works on increasing the aqueous outflow that is produced by the ciliary body. Remember, there's a backflow, so we got to get that fluid out some way, somehow. Now, the second medication that I use is what we call a combination drop. Okay, that means there's two drugs that they have combined together to make one, okay? And it's called Combigan, okay? Combigan includes brimonidine and timolol. Now, timolol is what we call a beta blocker, and it works on that ciliary body to tell it to, hey, calm down, stop secreting so much, okay? And then the other drug that's associated with Combigan is called brimonidine. Brimonidine is what we call an alpha-2 adrenergic agonist, which also works on the ciliary body, but it also increases aqueous outflow. So it actually does both. So as you can see, I'm taking 3 medications just to keep my pressures manageable. So now what I didn't tell you was what my pressures were to begin with. I'm glad you asked. So my pressures back when I first started this entire thing, back when I was 21 years old, were whopping 35 millimeters of mercury. Like I said, normal pressures are between 10 and 21. Okay, so for me, I had what we call ocular hypertension, which is also, for some will say, pre-glaucoma. Okay, and for that condition, you got to start early because glaucoma does not play fair. While using this medication, I've been able to bring my pressures significantly down all the way to the teens. I'm in the 13, 14 range, and that's been keeping me and my doctors very, very happy. Now, if you have this condition, or maybe you know somebody who has this condition, drop in the comments what y'all do, because there's so many ways that you can treat this condition, okay, depending on severity, okay, which I'll get into in subsequent videos. But anyway, guys, I'm gonna go ahead and leave y'all alone for that. Hope that was helpful. If you found any value in it, give us a like, subscribe, hit that bell for notifications, maybe even share it too if you like. But ultimately, guys, I'm gonna see you guys at the next episode. Until then, always remember, keep your vision clear. Peace.